Okay, so now let's take a look at the mechanism of prazosin. The mechanism of action for prazosin can be divided into two, which is the selective and competitive antagonist of alpha-1 adrenergic receptors, and hypotensive effects are not accompanied by reflex tachycardia. For the first part, the prazosin, which is a selective and competitive antagonist, will bind to the alpha-1 receptor on vascular muscle. The antagonist action will cause blockade of norepinephrine from binding to the postsynaptic receptor. Then, the prazosin, which is the antagonist, will bind to the receptor instead of the norepinephrine and will cause vasodilation. Then, the vasodilation will reduce the peripheral vascular resistance that will lead to the relaxation of blood vessels, allowing the blood to flow more easily. As a result, the blood pressure will be decreased.
As for the second part, hypotensive effects are not accompanied by reflex tachycardia due to, firstly, the central effect of prazosin to depress the baroreceptor feedback, and the second one is due to the lack of suppression of negative feedback mediated by the presynaptic alpha-2 receptors. Prazosin produces central effect that will depress the baroreceptor feedback, producing only small response to the heart. There will be no change in heart rate and reflex tachycardia will not occur. Next is the lack of suppression of negative feedback mechanism mediated by presynaptic alpha-2 receptors. The negative feedback mechanism is still activated and noradrenaline is not released to bind with postsynaptic receptor, minimizing the changes in sympathetic tone to the heart, and reflex tachycardia will not occur.
For your information, prazosin is also really beneficial to older people and is the best choice for those who have hypertension and benign prostate hyperplasia. Before we take a look at the mechanism of prazosin on benign prostate hyperplasia, let's find out what BPH is. BPH is the enlargement of the prostate that occurs when the cells of prostate gland begin to multiply. It will swell and squeeze the urethra and limits the flow of urine. So now, we proceed on how prazosin treats BPH. Firstly, prazosin will block alpha-1 adrenergic receptors located on smooth muscle of bladder neck and prostate and cause it to relax. Thus, there will be less pressure in urethra. Therefore, the urine flow will be increased and the patient will experience less pain.